Thank you, Craig. Risk is a part of everyday life, but there are many ways of controlling risk to people and property. High insurance premiums can price people out of certain markets. Government can use zoning and ordinances to encourage or impede development. Risk is ever present, but along the Gulf Coast, the greatest risk is reserved for the 5th season of the year, hurricane season. Hurricanes Rita and Katrina were reminders of how vulnerable all of South Louisiana from Lake Charles to Slidell is to the winds and waters of the Gulf. Hurricanes can't be prevented, but the risks they pose can be reduced. After the storms of 2005, Louisiana passed more stringent building codes for new construction. Paul Rainwater, head of the Louisiana Recovery Authority, says the regulations are effective.
After Hurricane Ike and Gustav, you saw examples of how that new building code saved homes and reduced property damage. There's no doubt about that.
Stronger new construction should lead to lower insurance premiums and a more stable Louisiana insurance industry, according to Rainwater. High insurance costs can mitigate risk by forcing homeowners out of hazardous areas, but state officials do not endorse any general retreat from coastal Louisiana. In fact, government policies often encourage living near the coast.
We have a working coastline. I mean, people work there, and so they need to live close to the coast. And people enjoy living there because it's part of their heritage, but it's also extremely important to the economy of Louisiana, and it's extremely important to the economy of the nation. And so the question is whether or not people should live there or not. They need to live there. What we have to do then is we have to put smart building codes in place. We've got to provide incentives for folks to build stronger and higher and basically safer.
FEMA calls these risk-reducing activities mitigation. Local governments can apply for federal grants to protect infrastructure from storm damage. Individual homeowners are also eligible for some of the $3 billion approved by Congress for post-storm mitigation in Louisiana. On a larger scale, many pin their hopes for reducing storm risk on massive public works projects, such as levees and coastal restoration. But experts warn that it's never a safe bet to rely completely on man-made fixes. When the Corps of Engineers finishes levee construction around New Orleans in 2011, it says many parts of the city will still be vulnerable to severe flooding. Public buildings, businesses, and private residences are growing in number each day along the coast, but most are taking on a remarkably different appearance.
We have flood elevation maps that we will probably adopt in October of this year, new FEMA maps. That will impose new height restrictions, stricter building codes. Construction will be a little bit tighter, more steel, more concrete, and elevated a lot higher. And we've done that through floodplain ordinances, the international building codes, and again, FEMA regulations that have been passed down since Katrina.
If you ride up and down this beach, even down just to where the air conditioning units are right now, you'll see them elevated up on concrete platforms and so forth to get them out of harm's way. So people are building stronger, they're building better. You get discounts now in the wind pool that recently the legislature just passed. So not only are we doing it on our own, but you can see where the state is giving us help to put these needed amenities into our homes so that we can not only live along this Gulf Coast, but we can live safely.
With such extensive damage, several of the towns have had to literally rebuild their infrastructure from the ground up.
We were able to eliminate 20 lift stations in our sewer operations, which is mechanical, it's potential problems that you could have. We've eliminated that. We have lifted all the electrical panels and lift stations and pump stations. Very seldom does a community have an opportunity to go back and do over again, have a do-over of what was done over the last 150 years. And if there's a silver lining in this cloud of destruction, that's it.
My name's Frank Barak. I'm a paramedic. My question as far as getting things into a different perspective is once we have the evacuations and your EMS services are taxed out and you now have them evacuating your nursing homes, evacuating the hospitals, evacuating the homebound. Once the general public has evacuated and they are now filling your surrounding areas. What do you have in place, or is there anything in place to handle the overflow of people from outside the areas? How do you get them to know what the contact numbers are for the different agencies? How do we get them into the hospitals, which will be inundated with emergency response teams and so forth?
When you get to events that are that big and require those type of medical resources, we're really talking about a national event. And that starts right at the president down to the Secretary Napolitano, and again with Administrator Craig Fugate, working with the different federal agencies to bring resources to bear. There's some things that we've done in FEMA to bring some of those resources. We've done contracts with ambulance companies to bring additional EMS resources available. We have agreements through Health and Human Services with underneath our authority. We could task them to bring teams into the state to assist and provide assistance to hospitals or to help with evacuations. Last year we utilized Department of Defense to assist with evacuations of special needs patients and those kind of things. And at the state level, they have their Emergency Management Assistance Compact where they could reach across state lines to other states to bring resources in. I'll let Mike talk a little bit about that, but that's another great system that FEMA is able to reimburse those costs and offset it, so that there's a system that works together from the federal to the state to the local level to coordinate those issues and offset those issues by moving resources either into the state or moving individuals outside the state if needed.
As you said, the local resources are going to be utilized and used up, so to speak. Then you're going to need to look within the state itself. Are there other communities that can provide these resources? And then you go to that Emergency Management Assistance Compact, or what's called EMAC. The thing that's happened since Katrina is that there's been more planning, more exercises utilizing that EMAC system. We frequently train with other states on how to bring in resources, whether it's the National Guard or medical resources like you're talking about, or law enforcement. And FEMA has been working very, very hard over the past 3 or 4 years to get all of these resources typed, so that if we say we need an ambulance with 2 paramedics in it, it means the same thing in Mississippi that it does in California. And that's going to help us tremendously when we get this system fully integrated, where we know what we're talking about nationwide.
I just would add, I think a couple key documents that helped done that is the National Response Framework, which kind of brings this all together as the nation's document on how this works, and then the National Incident Management System that all levels of government use, the Incident Command System, to do this, so we're all speaking the same language. Has helped in the communication.
Kathleen, you had another question about tourism, and as we kind of set a clean slate, you had some questions about how we prioritize.
The problem is we're sending a very mixed message out to the nation. On one hand, we're saying recovery is going very well and the tourists need to come back to the coast. And the other problem that we're having is that recovery is not going very well, that we still have thousands that are not back in their homes, and that we also have no money left on the table to do the rebuilding that needs to be done. It's very difficult to market for volunteers when you are as an industry are sending a message that everything's fine, and I'm down here in the trenches struggling every day with, I have an 84-year-old lady living in a doghouse right now. I have another lady living in her car. Not just 1, 2, but lots of them. We've got a long way to go with the recovery. How do we balance our marketing so that there's truthfulness in the marketing itself, so that both messages are getting out and both facets of the recovery are going to move forward? How do we do that?
My degree is in business and I majored in marketing, and I don't know. It's a hard task to do both of those. I think you just have to be real, try to separate the markets as much as you could.
But it's not happening, and that's the problem, and we're not addressing it.
In our county, we've established a housing resource center, and we're trying to, in that center, address all the needs you're speaking of. And it may end up being some of these places and these people that would come in. I don't know what all the options are, but at least these folks are tasked with finding housing for all those people. And I think we need to utilize that.
And actually, I don't mean to cut you off, but I think we have to go back to Beth and let the good people of Louisiana at least tell us about how some of these storm-related risks differ in Mississippi from those in Louisiana.
A big issue I think for average people would be insurance costs, and do we have insurance? And I have a question about that from Joe Delpit, a familiar face in Louisiana. Joe?
Thanks, Beth. I'd like to ask the panel what they know about the problems with the high deductibles in Louisiana. It's like a catch-22. A lot of the blue tops still up. And these are people who've, mostly elderly citizens, who've been paying insurance all of their lives. But now they find themselves having to come up with $5,000 or $7,500. The roof costs about $4,000 or $5,000, so what happens? Their roof never gets fixed. Then their homes begin to deteriorate, and then we have another problem, creating more problems for housing. Is there a subsidy through the federal government?
The FEMA assistance will be deducted by that insurance, but that we still have a certain amount that they can actually receive. So I think that in this manner here, what would happen, that person would register, and as that person would register, then it would have a caseworker, as you said before, and then we would see how much money that person would actually get. So I think it's a case-by-case basis that each person has to go through, and then we try to make allowances for that.
I'm a native of Terrebonne Parish, and I've been hearing my entire life about the need to restore the coast. Post-Katrina and post-Gustav, what are our state and federal governments doing actively today to restore our coastline?
The coast is being starved by dams that are built in northern states. That's good for economy, and it's good for production of electricity in the northern states. But the fact that we've done things to prevent the levee from deteriorating also prevents sediment from coming in and restoring the nourishment that our coasts need. I mean, the people of Louisiana and Mississippi have to be the sentinels of the Gulf. If we don't watch it, nobody will. And this is a serious issue, but I think it needs to be a national, it's going to take a national policy. This is going to be like the Marshall Plan. Because if we don't do something with the coast and start doing it soon, and it's going to have impact 50, 100 years from now, that when the storms come, they're going to have a bigger impact because that tidal surge has nothing to break it. And that coastline is going to take a national program. The people in Louisiana shouldn't pay and can't pay for the amount of money it's going to take to do it, but everybody who live up the Mississippi River is a part of the problem that's causing the problem on the coast right now.
It seems like we've learned a lot of lessons as we're having this conversation. If the rest of the country's learned a lot of lessons as well. Mark, what do you think are the priorities now as we look forward?
As far as priorities, we're talking about risk, but used to be that when we talked about prevention, risk was included in there. Now we've separated it. I think for the state of Louisiana, there's several priorities. Somebody in my office in senior leadership coined the phrase disaster independence and working towards that. And I think as far as the state's concerned, at the individual level, we need for individuals and families, and as far as pets, make sure that they're prepared and they do all they can at the individual level. And then when they can't do that, they go to the parish for assistance. And at the parish level, they try to be as disaster independent as they can, and then when they can't, they go to the state, and then we try to be as disaster independent as we can before we go to FEMA. But one of the areas that you talked about earlier is the whole sheltering, transportation and sheltering. That's probably one of the biggest priorities right now. It's for what we call the critical transportation needs population, those people that can't evacuate themselves. And you're right, other states, they've been very generous in the last few storms, and we know that we've got to build capacity, and that is a priority. There's legislation that was passed this year to give funding to locals so that they can build capacity in exchange for them allowing to use their facilities for shelters. 50,000 was a number that Ms. Nichols mentioned in her interview. We're working towards being able to shelter all Louisiana residents here in the state of Louisiana, not rely on other states. Last year, for example, we spent with the federal government close to $100 million, $30 million alone on transportation and getting people out of the evacuation zones. As you had indicated, sir, why not use that money to build shelters here in Louisiana so that we can be disaster independent? So that's probably one of the priorities, one of the main priorities that we have for the state right now.
And what is being done about the policy that Senator Landry was trying to move forward by burying some of these power lines, because that's the problem?
It's virtually cost prohibitive for the utility companies to bury those lines. And some areas they can, like in my subdivision, the lines are buried from the onset. I think you have to start now trying to be telling these subdivisions planners and those who are building, you can't build a subdivision anymore unless you bury those power lines and begin to go forward, because trying to go backwards, they will not be able to afford it. And I think that's going to be a real key component in trying to mitigate some of the damage in the future.
What are you going to do to help people like myself and others who have medical, and especially the elderly, who cannot stand in these lines to get emergency food or, the emergency food stamps or whatever, without risking their lives? Like I said, I got sick and I lost my hearing.
These are personal stories that are very powerful and a quick response.
Pre-register. Get the people pre-register. We can do it. We got the technology to do it. It's cheaper to do it. It's more effective to do it. Let's get it done.
And we're doing it now, and it should
pre-register.
Be
all right.
Processes.
So the test will be as we come for a next hurricane.
Right.
It's probably going to come. That will be the acid test. Thank you, Patricia, for that question. I'm afraid that's all the time we have for our Hurricane Lessons Learned program. I want to thank our panelists here in Louisiana, Ms. Hobdy, Mayor Holden, General Honore, Mr. Cooper, and Mr. Russell. Craig, over to you.
Many thanks to our Mississippi panel, Mr. Keller, Senator Dawkins, Mr. Womack, and Mr. Fenton. And thanks to our audiences in Louisiana and Mississippi. Please give yourselves a round of applause. Special thanks also to the fine staff here at Mississippi Public Broadcasting. They were great partners in this important endeavor, and we appreciate their hard work to make this a success. As we record this program, several storms have formed so far this hurricane season, reminding us that the residents of coastal states like Mississippi and Louisiana can never take Mother Nature for granted.
Well, all of the disaster experts that we spoke to told us that personal preparedness is the most important thing. Create a plan for you and your family and be ready to execute it if needed. Go to WWLPB for helpful tips on preparing for emergencies and for additional information on lessons learned from Rita and Katrina. While you're there, take this month's survey. Make comments and suggest new topic ideas. Good night, everyone.
Remember, immediately following this program, you can join a live online chat at www.lpb.org/Public Square. Experts from Louisiana and Mississippi will be available to respond to your questions and comments. We invite our Louisiana viewers to watch our September Public Square program. We will take an in-depth look at the healthcare debate in our state. Thanks for watching. See you next time.